COESA in Namibia took a bit of time to take off, but that time was necessary to build trust between different stakeholders who did not used to collaborate, especially around One Health. But once this trust has been built, this relationship, and I think the Netmapping workshop that occurred last year was very important for that, then the achievements of COESA will be the support to the design of the One Health framework for Namibia, which will be a keystone document for strategizing and developing an action plan for Namibia in the One Health context.
In terms of implementing One Health in Namibia, especially under the project, today we're working on Netmapping, and we are actually implementing all the activities that were supposed to be done under the COESA project, which is actually baseline survey that include the key informant interview, focus group discussions, and also net mapping.
I think net mapping is very critical in the sense to scope and review who are the key actors in One Health in the advancement and the optimization of health of the animals, the humans, the environment, as well as the ecosystem. That really helped us when we embarked upon the net mapping exercise last year, where we were scoping to see who is involved in which activities and what responsibilities are they covering.
We have started with the One Health approach. The very first step is to have a framework or a strategy. So we are at the process developing a framework, and this framework is at an advanced stage. A final draft has been developed, and we are getting inputs from our leadership in the ministries. So like the Ministry of Health, this framework has been presented to the department level, and the next level is the management, and then it will go to the policy before it is endorsed by the leadership in the Ministry of Health. And similarly, the other line ministries like Ministry of Environment, Ministry of Agriculture is also doing the same processes. Once these processes are finalized at the ministerial level, then the document will now be officially launched.
The challenges of implementing One Health in Southern Africa are common to other regions. It's all governments, all ministries have priorities, and One Health is not a priority, so that is a difficulty to try to motivate stakeholders.
The current landscape of One Health in Namibia, I should say, the ministries that are involved in One Health, they are implementing these activities on One Health in silos and so on. There were not coordinated efforts in terms of addressing One Health. Say, for example, if the Minister of Health and Social Services go to the field and so on, they are only focusing on human health and so on. Environment, they are also focusing on animal health, even though human is also an animal, and so on. So there's a need to collaborate, to work for these three ministries to work together.
Government priorities is like in the northern communal areas, we have a challenge with rabies, and the most important thing is that no single life be lost. So whatever is preventable should be prevented. That's the priority. That's why government prioritizes One Health, that not only focus on human health, but also animal as well as the environment, so that in which other direction the pathogens may show up is already identified and kept.
The next level of One Health in Namibia, and our desire is, of course, to advocate for and lobby for the establishment of a National One Health Institute, of which we are in an advanced stage of developing a advocacy strategy for the establishment of a One Health Institute. On the roadmap ahead of us, we also have already stakeholder engagements with the National Institute for Education in the country, which is called NIAT, where we are also looking into integrating One Health into the school curricula. And then, of course, our biggest dream is to have a One Health National Institute.
We cannot talk of One Health without biosecurity and biosafety, you know, because what are we doing? Even during One Health, there will be samples that will be taken. There will be samples that will be transported, you know, and lab part is key also in One Health. And One Health without money, funds, is not possible. So for One Health, the key partner that we also need to get on board is the Ministry of Finance. And because it's national security, health security is national security. So we should also involve the Ministry of Defense. Then we'll know One Health is really embracing all the key players, key stakeholders.
One Health is really important. It's a cross-cutting issue. One Health matters. If there's no One Health approach integrated across the various sectors, we can forget about having a healthy nation, a healthy ecosystem, and a healthy animal system.